Welcome to HiNZ 2017. We're here visiting with Simon Koss, who is CMO for Microsoft, based in Seattle. Simon, I sat in on your session this morning. The future is here. It's just not evenly distributed. Can you tell us a bit more about the highlights of what you spoke to us about this morning?
You bet. So I think about innovation, and the quote I use, "The future is here, it's just not evenly distributed," that comes from William Ford Gibson, and I think it characterises what we've got here in healthcare. You look around, and I'm lucky enough to have a role where I get to see innovation on a global scale. Microsoft's got about 12 to 14,000 partners delivering solutions around the world. So I get to see that innovation, and I think if we just took a bit of best practice from here and here and here and put it together, we'd have the future health system that we all want. So that's been the thrust of my talk, and very much I believe that sustainability of our health systems, at least in our modern developed worlds, is probably one of the biggest problems. The fact that we've shifted from a reactive healthcare system that treats sick people to how do we get on top of the health and wellness and support people and consumers as they start to manage their own healthcare systems. So part of that was innovation, and then part of it is the shift of model that we need our systems to address.
Yeah, one of the other things you spoke about, Simon, was in using the new technologies, it creates room for clinicians to work at the top, and you use the expression, the top of their license. I thought that was an interesting analogy to do. Can you expand on that a bit more? What does that mean in terms of the workforce and in terms of the applications of the technology?
Yeah, sure. So that's not a term that I was familiar with coming from Australia, but now with 18 months under my belt in the US, staff productivity, clinical productivity is top of mind for the management. Human capital being one of the biggest expenses that a typical health organisation has. It's one of those great levers if we can get more productive. And the assumption is that for most clinicians, they in turn would like to be providing care at the top of their licence, doing the sorts of higher order thinking that they were trained to do and keeps them engaged, as opposed to the more routine, mundane tasks that frankly are ripe for disruption through artificial intelligence replacement. So I use the example from Iris, and Iris is one of our great partners in North America, and they've taken the visit to the ophthalmologist and turned it into a hardware software appliance that you can drop in a primary care office, a GP's office, or potentially even in a pharmacy or a supermarket. And in doing so, they've disrupted that business model for ophthalmologists who are used to patients making their own appointments, turning up, waiting in the waiting room. All of the logistical and management overhead goes down to the patient, and the clinicians just sit there and are able to service that demand. To this model, where we flip it, and the patient doesn't even need to turn up to the ophthalmologist at all. They get those images taken of the back of their eye, and it goes up to a cloud service where ophthalmologists can pick them out of a queue and report them at their leisure and send them back down. The whole turnaround time is faster, but you think about what that would mean for an ophthalmologist who is used to the more traditional model of, hey, I have patients come to me, and when they do, the images stay with me and I do the reporting. I think it's interesting to think about how artificial intelligence will make its way into healthcare, how it will change role types, and clearly there's a bit of disquiet around that. But I also gave the example that, hey, when I was practicing, all of the ECGs would spit out without an interpreted a diagnostic interpretation on it, and now they all come out like that, and cardiologists aren't paid to report ECGs anymore, but the cardiologists are still around. They've still got jobs. We've all got hearts, and arguably there's a greater need for their services than there ever has been. So when I think about the future, I know things will change, but definitely the humans are still needed, and hopefully get to do that top of license practice. This is what we train to. Now I'm focusing on the higher order thinking rather than the routine high volume tasks.
Yeah, one of the other things you talked about, you just mentioned the future directions, and you gave some examples in one of your slides of the categories and then examples. Could you just expand on what some of those future directions are that you cited?
Yeah, sure. So that slide was my own creation.
Was it?
And it's a reflection of my maturity in thinking about how do we use digital technologies to make a difference in healthcare. Once upon a time, I simplistically thought that we'd just put in electronic medical records and then everything would magically get better. And now I see that as digitisation of the system of record for providers and for the hospitals, but that's just the first rung on the ladder. The broader view, which I think is digital transformation, that comes after you've done your digitisation, is how do we better engage patients? How do we empower care teams and providers to do their best work? How do we use that data asset to optimise our clinical and operational effectiveness? And then how do we transform our models of care using some of that technology? So across those 4 domains, in the engage your patients category, we're investing in artificial intelligence agents to have a chatbot type experience. So right now we know that most people, when they're unwell, go straight to the web and they punch in what's going on, and that's their trusted source of information. It's not clinically validated, but it does yield some interesting responses. Eric Horvitz, who's one of our researchers in Microsoft Research, was published last year in 2016. He was able to find patients with undiagnosed pancreatic cancer just by their web searching history based on the terms that they were popping in. So that was interesting. So we're working with a chatbot service that is health grade compliant, and we've taken it through the US HIPAA process so that it can deal with protected health information in an appropriate way. And you can imagine now that someone sitting at home would be able to engage with this service and punch in their diagnosis and be asked a clinical history. And at the end of it, it could give you some guidance about these are the likely diagnoses and here's what you should do about it and what sort of urgency. So that's the clinical engagement side of it. We also think that navigating the health system with dynamic care plans and health plan navigation services is important. As far as empowering providers, right now we do a lot of face-to-face care delivery, and I think there's enormous scope for virtual care, and that's everything from relatively mainstream telehealth and telemedicine all the way up to virtual clinics and the medical home. So we've got some projects there. The intelligent medical assistant is this whole concept that if clinicians are spending increasing amounts of time in the electronic medical record, that's taking them away from patient care. How can we put a layer in so that as you have your patient consultation, artificial intelligence can semantically understand that and create a structured narrative out of it? And then I can interrogate the record. So I can ask it, what is the patient's hemoglobin? And what was the last temperature? And it'll speak back to me rather than me sifting pages through pages. Mixed reality is another thing that we saw starting in the education and learning and training simulation side of things, and is rapidly making its way into mainstream care delivery. We see a lot of uptake in the surgical disciplines as well, both the pre-operative planning and also even in intraoperative assistance with heads-up augmentation. On the data side of things, we're working with artificial intelligence, video analytics, image analytics and natural language processing. That's a big focus. And then on the transforming the care continuum at a fundamental level, we see an enormous overhead for genomics to come in and usher in an age of precision medicine. So when we're able to tailor our therapies down to the individual patient level, using their genome but also using other data we've got, that's where we see the next 5 and 10 years going.
Very exciting times ahead,
yeah, really.
Simon. We'll all be on the journey with you. Thank you so much.
You are very welcome. Thank you.
Thank you.